Acute encephalitis in children, a serious threat and preventive measures. This article is professionally reviewed by Dr. Nguyen Thi My Linh, Pediatrician. Hospital name. Dr. Nguyen Thi My Linh has 12 years of experience in diagnosing and treating pediatric diseases. 1. What is acute encephalitis? Acute encephalitis is a condition where the central nervous system is damaged due to viruses, bacteria, or parasites directly attacking the brain, causing inflammation. This inflammation disrupts motor function and cognitive processes. Several factors can trigger acute encephalitis, including 1. What is acute encephalitis? Viruses. Common viruses causing acute encephalitis in children include influenza, mumps, measles, herpes simplex virus, enterovirus, etc. Bacteria can cause acute encephalitis due to middle ear infections, sinusitis, pneumonia, or bacteria entering the bloodstream. 1. What is acute encephalitis? Parasites. Certain parasites such as Toxoplasma gondii, Naegleria fowleri, Acanthamoeba, etc., can lead to acute encephalitis in children. 2. Signs of acute encephalitis in children. Early symptoms of acute encephalitis can be mistaken for a common cold. Children may exhibit the following signs: high fever, temperatures above 39 C, potentially reaching 40 C, with occasional periods of fever reduction. 2. Signs of acute encephalitis in children: sleepiness, lethargy, excessive sleep, difficulty waking, and sluggish reactions. Headache, severe headache with no clear cause. Vomiting, repeated vomiting, often forceful. Seizures may include generalized seizures or seizures affecting specific body parts. 2. Signs of acute encephalitis in children: loss of consciousness, the child may become unconscious, unresponsive, or confused. Movement disorders, muscle weakness, paralysis, or stiffness. Visual disturbances, blurred vision, double vision, or loss of vision. 2. Signs of acute encephalitis in children: speech impairments, difficulty speaking, slurred speech, or loss of speech ability. Hearing problems, hearing loss or complete deafness. Mental disturbances, changes in personality, behavior, or delusions. 2. Signs of acute encephalitis in children. Note: the symptoms of acute encephalitis can vary depending on the causative agent, severity of the illness, and the child's age. 3. Complications of acute encephalitis. Acute encephalitis can result in various dangerous complications, including respiratory failure due to damage to the respiratory centers in the brain, cardiovascular failure caused by damage to the cardiovascular regulatory centers in the brain. 3. Complications of acute encephalitis. Permanent brain damage leading to lasting disabilities like paralysis, intellectual disability, epilepsy, etc. Death. The mortality rate from acute encephalitis can be high, particularly in young children and older adults. 4. How to prevent acute encephalitis. To prevent acute encephalitis, parents should keep the following in mind. Complete vaccination. Vaccination is the most effective way to prevent acute encephalitis caused by viruses. 4. How to prevent acute encephalitis. Maintain good personal hygiene. Wash hands frequently with soap and water, especially after using the restroom or interacting with animals. Practice safe food hygiene. Always cook food thoroughly, avoid eating at unhygienic establishments. 4. How to prevent acute encephalitis. Avoid contact with sick individuals. Limit contact with individuals who are ill or suspected of having acute encephalitis. Use mosquito repellent. Maintain a clean environment, eliminate mosquitoes, particularly during the summer months. 5. Treatment for acute encephalitis. Treating acute encephalitis depends on the underlying cause and the illness severity. Treatment options may include symptom management, reducing fever, lowering body temperature, preventing nausea, etc. 5. Treatment for acute encephalitis. Specific treatment: administering antibiotics, antiviral drugs, or antiparasitic medications based on the causative agent. Respiratory support: providing respiratory support with a ventilator if necessary. Nutritional care: ensuring adequate and appropriate nutrition for the child. 5. Treatment for acute encephalitis. Rehabilitation: engaging in rehabilitation exercises after recovery. 6 notes: if your child exhibits symptoms suggestive of acute encephalitis, seek immediate medical attention for timely diagnosis and treatment. Acute encephalitis is a serious illness requiring close monitoring by a physician. 6 notes: prevention is better than cure. Parents should emphasize preventive measures to protect their children from acute encephalitis. In conclusion, acute encephalitis is a dangerous illness that can severely impact children's health and lives. Parents need to be vigilant for signs of the disease and seek medical care promptly. Complete vaccination, maintaining good personal hygiene, and implementing preventive measures are the most effective ways to safeguard children from acute encephalitis.